everybody, Dr. Britt Talley Daniel MD, and I'm a neurologist and headache doctor. Today I'm talking about, do NSAIDs cause medication overuse headache? Well, NSAIDs is a mnemonic, so the letters make up a name, non-steroidal anti-inflammatory drugs. Just like SOB means shortens the breath. And they're class 2 drugs, NSAIDs, which are used for painkillers, and they're also anti-inflammatory drugs. Steroid hormones are made in the adrenal gland, which looks like Napoleon's hat sitting on top of the kidneys, in the back of the abdomen, and both sides of the body. Ad means next to, and renal means kidney. Cortisone, an artificial steroid hormone, was isolated by the Mayo Clinic doctors who won the Nobel Prize in Physiology and Medicine in 1950. Common names for cortisone is now used in medicine are prednisone, hydrocortisone, medrol, cytomedrol, or decadron. Cortisone drugs have significant side effects, and the use is restricted to treatment for serious medical problems like rheumatoid arthritis. NSAIDs are not cortisone drugs. They have reduced anti-inflammatory effect and have fewer side effects. When these drugs came out, they were name brand originally, and then they were prescription only, but later now they've been released without the need of prescription over the counter at a lower dose. An example of this would be Motrin, which came out as name brand in the doctor's prescription at 400, 600, and 800 milligrams, but Motrin is the same as ibuprofen, which is Advil, and Advil come out over the counter at a dose of 200 milligrams, can be dosed every 4 hours. So NSAIDs are a common cause of medication overuse headache. The question is, do NSAIDs cause medication overuse headache? Well, they're a common cause of this, especially in patients with migraine. The International Classification of Headache Disorders, third version, says that taking NSAIDs, only one pill 15 days a month, can cause medication overuse headache. And Tylenol, aspirin, and caffeine are also in this headache-producing group, but they're not really classified as NSAIDs. Related questions. So what are the common NSAIDs now used in America? I'm just going to read a list here. Celebrex, Diclofenac, which is Cambia, which is used for migraine, ibuprofen, indomethacin, naproxen, ketorolac, Dapro, and Feldene. What are the medical side effects of using NSAIDs? The most common side effect is gastric reflux, abbreviated as gastroesophageal reflux disorder, or called GERD. And that has symptoms of heartburn, nausea, vomiting, diarrhea, or headache. So medication overuse headache and GERD are comorbid, which means these two medical problems come together more commonly than by chance. And use of NSAIDs for headache can also cause or aggravate GERD, which is usually improved when they see their headache doctor, and improve by taking all their NSAIDs, so both those get better. The other specific side effects of NSAIDs are nausea, vomiting, diarrhea, constipation, decreased appetite, a rash, dizziness, headache, of course, medication overuse headache, drowsiness, kidney failure, primarily with chronic use, liver failure, ulcers, and prolonged bleeding after injury or surgery. What's the relationship between NSAIDs and medication overuse headache? The problem is that many persons may get daily chronic headache or an aggravation of headache by overtreating over 15 pills days per month. One pill 15 days a month with these drugs. And it happens with aspirin, etc., and Tylenol also. So NSAID overuse can aggravate headache. This is worse for persons who overtreat with painkillers and an inherited migraine gene. They just had mild migraines before, which was no big problem, but once they start overtreating, it becomes prominent. And migraine hides in the public experience undiagnosed. Something like 56% of persons with migraine never been diagnosed by a doctor. And for some persons, they're not that bad, they never call it migraine, usually treated with over-the-counter drugs like Advil or Aleve. But the patient may have also, when you see them, migraine aliases or features like, they'll call it sinus headache, hungry headache, nocturnal headache, let-down headache, weekend, Saturday or Sunday morning headache, or menstrual headache, which is aggravated by overtreatment. Tension-type headache and migraine patients also occur. So some persons with tension-type headaches also get medication overuse headache with overtreating. Commonly, the patient has lived with their episodic mild tension headache for years, but when they get into this, they'll start frequently treating with NSAIDs, taking multiple doses every day, and they end up in the ER at a headache doctor's office with severe headache and migraine features as mentioned above. Serotonin levels also drop with this treatment. So medication overuse headache causes serotonin, a calming brain neurotransmitter, to decrease, and this results in psychiatric symptoms of insomnia, anxiety, panic attacks, decreased concentration, and irritability. SRIs, or serotonin receptor inhibitors, or SNRIs, drugs that bring up serotonin, the norepinephrine receptor inhibitors, are approved by the FDA for treating depression, anxiety, and panic disorders, and many of these patients present in a neurologist's office with daily headaches and taking either an SRI or SNRI, which ain't working. It's not working because medication overuse headache is dropping their serotonin, and they are then more edgy and have more trouble with anxiety, insomnia, and panic symptoms. On the edge. Many of these medication overuse headaches have been on the edge of medication overuse headache for some time. They may drink a lot of coffee daily, like regular coffee, and 10 ounces has 135 milligrams of caffeine. Or Starbucks coffee, which has 3 times as much caffeine. When you're driving, you see all the people stop over at Starbucks. There's a parking lot over there. They're all hooked on caffeine and over-treating them. If you don't have migraine, it's no big deal. But if you have migraine, it can be a problem. The patient may be at stress at work or in a relationship or current problems in their family. And stress is always the #1 feature that drives migraine as an aggravating feature. The patient may have never been given the best acute therapy for migraine, which is a triptan. There are now 7 generic, reasonably priced with insurance triptans. May they've always been treated their migraine headaches with an NSAID, and no kind internist or general practice doctor has ever prescribed the best drug for acute therapy for migraine at onset of migraine, which is a triptan. 5 of the triptans are regular migraines that have effects of medication. Regular treatment drugs have an effect within 30 minutes, and those are sumatriptan, rizatriptan, elatriptan, zolmitriptan, and almatriptan. 80% of patients who take a triptan at the onset for migraine are headache-free in 2 hours. And so if you get rid of a headache with get rid of a migraine with one drug, then you usually don't end up over-treating, is the idea. Triptans provide medications effective for acute therapy of migraine. The patient doesn't have to take multiple doses of NSAIDs for days on end. And the action is in a couple of hours, and with the 5 acute drugs in 30 minutes, they start working. So they're a better choice for persons who have this symptoms. Patients who have menstrual migraine are oftentimes given naratriptan, which lasts 6 hours, or frotriptan, which lasts 26 hours. The problem with those drugs is that their onset action is 1 to 2 hours, and the other 5 acute therapy drugs are 30 minutes. So the acute therapy drugs are a better choice for most non-menstrual related migraine patients. Doctors are supposed to educate the patient to withdraw off the drugs. So the treatment of the common problem of medication overuse headache, which is 80 to 90% of new patients to a headache doctor's practice, is to educate and instruct the patient to withdraw from the offending medication. Oftentimes the doctor may start a preventive drug, use DHE shots or nasal spray or timolol eye drops for acute therapy of migraine, and often a week or 2 of prednisone. Follow the patient carefully to get them off of their headache medicine. So the triptans were the first drug to come out. It was an injectable Imitrex, which is now sumatriptan, 6 milligrams subcutaneously. That's still the best and strongest and fastest dose for treating migraine. All right, so there's a list of sumatriptans and drugs, triptans on my webpage at drmigraine.com. I'm not going to go through that all with you, but I would like to next discuss what's called the migraine timing cycle. So migraine has 4 steps in the migraine process, which I like to call the migraine timing cycle. And a picture of this is on my blog article at drmigraine.com. Just look up at medication overuse headache, it's in there. First step is trigeminal inflammation by the brainstem, stage 1 of migraine. The second step occurs at 20-40 minutes into the headache. So the headache starts at 8. At 8:20, 8:40, the ganglia of the nerve and the artery of the brain start to release these 3 neuropeptides, which are inflammatory. And they are neurokinin A, substance P, and CGRP. In about 2 hours, the release of these chemicals causes the third step, of the migraine process, which is meningeal artery vasodilatation, and the fourth step occurs at 3 to 4 hours in the headache, so we're like at 11 to 12 o'clock in the story I'm telling you. And that gets inflammation of the thalamus, which is a deep nucleus in the brain, and it's also called the pain center of the brain. The fourth step in the neurology literature is also called central sensitization, because steps 1, 2, and 3 occur in the skull, but really outside the brain. So the trigeminal nerve, the arteries, arterial ganglions are not part of the brain within the skull, but only the thalamus is part of the brain, actually, a deep nucleus. So a definition of migraine is defined by the International Classical Headache as lasting 4 to 72 hours, and it's not done because of some trivial, abstract, academic reason using 3 days or 72 hours as the time of migraine may last, but rather because that's how long these inflammatory conditions, chemicals, stay in the body. They come in the brain, they drain down the neck, into the liver, where they're metabolized, and they're out in the toilet in 3 days. So if someone treats a migraine with painkillers or over-the-counter drugs or NSAIDs, they don't relieve or stop the release of these drugs, these chemicals. But triptans will do that. So if you treat a triptan at onset, you don't get these neurochemicals that come out. The arteries and the ganglion are not inflamed, the thalamus is not inflamed. That's how they treat so well. There are no-no drugs for migraine. A patient with migraine should treat with triptans, but never with opiate drugs. There's a big problem with opiate narcotics in America. So many people dying from it. There's no limitations from it. There's lawsuits going on about it. They really shouldn't be used for treatment for a headache at all. And barbiturate, a drug usually mixed with an analgesic like Fioricet, is listed as the worst drug in the world that causes medication overuse headache. And butalbital has been banned in every country in the world except Canada and the United States. And the use of butalbital in America is a political issue to be resolved with legislatures. And so far, neurologists and headache doctors have not been successful getting legislators to change the law to eliminate the use of butalbital in America, like every other country in the world has done, except Canada and America. So limited drugs for migraine. Caffeine, Tylenol, Advil, Aleve, and triptans can cause medication overuse headache if taken too much. And the general rule for migraine patients to prevent medication overuse headache is to limit over-the-counter drugs, triptans, to no more than 2 days a month. I mean, you can't take caffeine every day for some person to get a medication overuse headache, because that's a drug, and that can cause this. And, caffeine is said by the American Headache Society to be the #1 drug in America that causes medication overuse headache. So medication overuse headache is the current term for persons who have usually chronic migraine from overtreatment. And this syndrome used to be called rebound headache, which is synonymous with medication overuse headache, but probably the best choice now is the medication overuse headache. A chronic migraine is defined by the International Classification of Headache as being 15 headache days a month, 8 of which have migraine features. An episodic migraine is defined as 14 or less headache days per month. Now there's a transformation from episodic to chronic. If a patient uses the over-the-counter medications or a triptan, a transition occurs, so after several migraine headaches have occurred within a week or two, every time the patient takes caffeine or Tylenol or a triptan, these inflammatory neurochemicals are released in the brain. They stay in the body for 3 more days, and so the migraine process becomes continuous. It's sort of like putting lighter fluid on a fire, which makes the fire continue to burn. If one considers that migraine can generate chemicals that last 3 days and multiply that by 2 days, the result may be 6 days of neurochemical release per week. So if the doctor allows patients to take Tylenol or triptan 3 days a week, that's 9 days with chemical inflammation, and that's more than the 7 days a week, and explains the absolute limitation of all painkillers and triptans to no more than 2 days a week. On my webpage, I tried to be humorous about this. I've got a picture from a movie showing the transformation of an actor playing Dr. Jekyll to Mr. Hyde. This transformation, we talk about a chemical transformation of the brain that occurs with medication overuse headache. Headache-free. So headache-free means that all migraine symptoms are gone. So if you take a triptan within 2 hours for a single episode of migraine, 80% of patients are headache-free, which means the headache, the nausea, the sound sensitivity, light sensitivity, olfactory sensitivity, mental cloudiness are gone. In my office, I go over and over again this with patients to treat early, and usually then the next time they come in, they'll report they did well with the triptan, and the migraine's gone early. And many patients tell me they get relief within 15 or 20 minutes, which is less than 30 minutes at a time, that it's stated by the FDA that the generic triptans work. You can go to my webpage, and I have a segment under my categories on medication overuse headache and several articles. You can read some of that. Next, I'm going to talk about who gets medication overuse headache. Persons with migraine or overtreat will get it. 90% of persons who have chronic migraine also have a diagnosis of medication overuse headache condition due to overtreatment painkillers. So medication overuse headache occurs in 3 to 4% of the world population, but chronic migraine only 1 to 2%. Probably persons who get medication overuse headache within migraine have a special genetic quality to them, which has not been defined yet, that makes them get it, whereas other migraine patients don't get it. Okay, what are known factors that are known to be associated with medication overuse headache? And I'm just going to list these. Caucasian background, female sex, lower education, a previous marriage, overweight, obstructive sleep apnea, OSA, frequent caffeine use, stressful life event in the previous year, and head injury. Also, patients who are overusing medication, as mentioned, persons who have comorbid depression, migraine and depression have 50% comorbidity, patients who are smoking. So this is the end of my dictation on this subject of NSAIDS and medication overuse headache. I hope it's been helpful. Thanks for watching and listening. Please click subscribe down there so we can follow each other. Follow me on YouTube for other articles I have on migraine. God bless all you persons who have migraine and medication overuse headache. Really a terrible problem. And I will see you on the next talk.